Okay, welcome everyone. Thanks for joining Chillicothe Public Library and Unity Point Health Unity Place for this discussion on isolation and the opioid crisis. I'm Catherine Barnett, Adult Programming Librarian here at Chillicothe Public Library. Before we get started, I'd like to go over a few housekeeping items. A handout for tonight's program is available via the link that I've dropped in the chat window. And at any time during the webinar, you can submit questions for our presenter, Sue Tisdale. If you're tuning in through Zoom, just click on the Q&A tool in the control panel at the bottom of the screen and type your question into the Q&A box. If you're watching on Facebook, drop your question into the comments. As time allows, Sue will address as many questions as she can at the end of the presentation. We will be recording this webinar and we'll share the link at chillicothepubliclibrary.org. I'd now like to introduce today's speaker, Sue Tisdale. Sue is a community educator with the Drug Overdose Prevention Program at Unity Point Health Unity Place. Her position is supported by a Drug Overdose Prevention Program grant received in 2017, which provides free opioid education, awareness, prevention, resources, and support, as well as nasal Narcan training and distribution to 14 countries in Central Illinois. Welcome, Sue, and thank you for being with us tonight.
Thank you for having me, Catherine, and giving this opportunity to have this discussion this evening with hopefully all of Central Illinois. So we'll go ahead and get started. So as Catherine introduced, I am Sue Tisdale. I work for Unity Point Health, Unity Place. Unity Place provides mental health and substance use care and treatment and support in a variety of methods. So we're here this evening to discuss opioids and the opioid epidemic in relation to COVID-19 also being a health epidemic. So we have dual health epidemics actually that are going on. And I'm thankful to be able to bring awareness to the fact that these dual health epidemics are both just as important, because this has to do with fatalities, morbidities. So just to put some things into perspective about my personal position as a community educator with the Drug Overdose Prevention Program grant, as Catherine stated, covers 40 counties in Illinois. I personally cover 14 of those counties. So from LaSalle County all the way south and west of there, clear to Adams, Pike, and Scott counties. With this grant, what my primary purpose and what I do is provide education about opioids, education about overdose prevention, and bring awareness, just as we are this evening, about the opioid epidemic and, of course, overdose prevention. I really don't hold a lot of office time with this position. I'm on the go quite often. And this free education and prevention is available to anyone, any individual, any organization, any groups, anyone and everyone. So I can't emphasize that enough. I have personally been affected by opioid use disorder and overdose. I got associated with this grant in 2017 because of my personal experience with overdose and opioid use disorder with my son. In 2015, I lost my son to an opioid overdose. It was 2 weeks before his 29th birthday. From that year, later in that year on, my daughter and I started doing prevention in the county that we reside in, which is Fulton County. So we started training and distributing naloxone, also known as Narcan, to make an attempt to try to save others' lives, so that they don't have to experience the same loss that we have been through. With that, working under this grant and doing the education and the prevention, yes, it's something that you can study and learn about, but it's also something that with real life experience, it is very helpful to be able to be compassionate with others and understanding of what their struggles and obstacles may be. So that's just a little history about my personal experience and how I got connected with my professional position as well. In 2018 to 2019, the United States experienced over 80,000 deaths due to overdose. That's almost 200 people every single day dying from an overdose, and every overdose is preventable. To date, with the Drug Overdose Prevention Program grant that was established in 2017, we have trained in these 14 counties over 9,600 individuals, and we have distributed over 5,300 overdose rescue kits. So to absorb the magnitude of opioid use disorder and overdose is substantial, no different than as is with COVID. The effects that COVID-19 is having in reflection to the opioid epidemic, the isolation and restrictions imposed from COVID-19 are causing additional mental health and substance use obstacles and struggles. It's also playing a huge contributor to an increase in local overdose response calls from our local first responders. According to Jamie Harwood, the Peoria County Coroner, to date for the year 2020, Peoria County has experienced 21 overdose deaths to date. As far as first responders and what they are seeing since COVID-19 and the isolation portion of this, the impact that they are seeing, a reflection of COVID-19 with possible overdose calls and responses the calls have almost doubled in April, May, June, and what we have the data of for July. So with that, the isolation has impacted people that may have been in recovery from opioid use disorder or substance use disorder. It looks completely different to all of us, especially those that may have been in a treatment or support environment that was vital to them every single day. And when I say that, I mean maybe it was counseling one-on-one, human connection, maybe it was NA or AA. Those meetings were discontinued as far as meeting face-to-face and went digital. So that's played a huge impact on a lot of people. Also, access to treatments. That appears in a completely different way to some people and what they may have been accustomed to. Significant, drastic changes have impacted those that are in recovery and that may risk relapse due to all of these abrupt changes in their regularly scheduled programs. Something else COVID related to the opioid crisis that plays a huge role, even outside of the opioid crisis, is the human connection. Having the capability to sit down with an individual one-on-one or in a group setting and have conversations now is near non-existent. that has played a huge impact on a lot of individuals in structure. Very vulnerable group of individuals are the people that may be in recovery or that may be new in recovery, or possibly those that are still struggling with opioid use disorder, having access to even harm reduction measures, access to naloxone distribution, which is something that I'm working very hard at to try to make sure that everyone in the community has access, easy access, obtainable access to having and being educated about how to use naloxone and what it is. Also, there's a positive to this in a sense with opioid use disorder. In turn, with some of our treatment methods, when we talk about treatment methods, one of those is medication-assisted therapies, buprenorphine and methadone. Since COVID-19 and the isolation and restrictions have been imposed, those medications have now been made more readily available to people. Whereas before there was limitations on maybe how many clients and patients a physician could prescribe to just for medication to maintain opioid use disorder and treat it. And let me note that medication-assisted therapies are one of the most successful means in recovery for opioid use disorder. They are the longest sustaining methods of maintaining sobriety and recovery for opioid use disorder. Something else with the opioid use disorder, opioid crisis with COVID is the criminalization that occurs with people that use drugs. On a normal day prior to COVID, this was a heavy burden. My son once told me, and he struggled with opioid use disorder for over 30 years, was seen jail time several different times. But he once told me that his criminal activity was not because he was a hardened criminal, but because of his opioid use disorder. And that's steadfast and true for most individuals today. So the criminalization of this, of the opioid epidemic also fuels and intensifies this crisis even more so. On the Illinois Department of Public Health opioid dashboard, and this is available to anyone that wants to tune in and go to their website and look at this every day. It's updated. That will give you a breakdown statewide per county, details about the opioid crisis. So when I say that, it will dial in on, say, Peoria County of what is the age group that we are seeing for overdoses. And currently the age group, the most common age group is years of 35 to 44, and it is a male. What is the most prevalent contributing drug to a lot of these overdoses? And now, current time, what we are seeing is synthetic opioids, fentanyl. Fentanyl is 50 to 100 times more potent than morphine or heroin. A minuscule amount of fentanyl would kill someone such as myself, maybe the size of a granule of sea salt. Something that I also wanted to talk about is stigma. We still have a lot of stigma and stereotypes associated with substance use, opioid use disorder, and the opioid crisis. And overcoming stigma is really important in order to open doors for individuals that may be seeking help, for family members and loved ones that may be looking for support and direction and how to help their loved one. So stigma is always something that is really important to me. because even treatment therapies and all of that go with the opioid epidemic are stigmatized to a certain level. Methadone, for instance, has always kind of been given a bad rap because of not the medicine, but because maybe of the way it was prescribed. People that are dependent upon opioids, those people in general have always been looked down upon, and that this was a choice for them, that this is a moral failing, when in fact, with COVID-19, we all are focused in and paying attention to the scientific facts that drive COVID-19. And we need to do the same with the opioid epidemic as well. Science will tell you and educate you that with opioid dependence, the brain and the chemistry of the brain is completely changed. So dependency is more than just a choice. And I provide that education and that discussion in my presentations that I do with our drug overdose prevention program grant. So reducing stigma, of course, for those that are actually struggling today, right now, may be the difference in whether someone steps up and asks for help. And with that, maybe even at their family level, even to understand this, to overcome the stigma. I also, there was a poll, I believe, that Catherine had put out for attendees. Is that posted now, Catherine? There we go.
Yeah, I launched it. It doesn't look like we have any attendees right now in the Zoom meeting itself, so we probably won't have responses on that.
Okay, that's good. That's fine.
Question there was, are you or have you been affected by addiction in any way?
Oh, wait a second. Sorry, I'm pushing the wrong things at the wrong time. Okay, I'm sorry. What did you say? Could you repeat that?
Oh, I was just reading the question from the poll.
Oh, okay. All righty. Okay.
If you have or are.
Yes. Okay. Yes. So what I wanted to also talk about in relation to COVID-19 and the opioid epidemic, all lives are very important. Better health is important across the board for every single person. And more so even now for those that struggle with opioid use disorder. Their health is even at a greater risk with COVID-19 as well, because notoriously people that struggle with substance use disorder, opioid use disorder, maybe have not taken the best care of themselves also. So also, don't be afraid to reach out for help. If you have a loved one or if you are struggling, don't be afraid to ask for help. Unity Point Health and Unity Place have a really good website full of resources and direction for someone that may be looking for if it's mental health or if it's substance use focused, opioid use focused. Also, the link to the drug overdose prevention program is available at that site as well to access free naloxone training and distribution. So I wanted to take a minute and talk a little bit about naloxone while I have the time here as well. We're talking about the opioid epidemic in relation to COVID-19. Naloxone is also known as Narcan. This is a medicine that's been around since the 1960s. And unbeknownst to me, prior to my son's death, I'd never heard of it. So I'm certain that there are other individuals that have also maybe not heard of it or know what it even is. So with that, it is a medication that if administered in a timely manner in response to an opioid overdose, it will reverse the effects of an opioid overdose. Essentially, could assist in helping that person breathe once again. I provide this free training and distribution of nasal Narcan. And I have actually, and I don't know if you can see this very well at all, but this is what 1 dose of nasal naloxone, nasal Narcan actually looks like. It's very easy to use. And everyone in the state of Illinois is protected under the Good Samaritan law to be in possession and to administer Narcan in good faith to save someone's life. So please, if you're looking for additional information in regards to the opioid epidemic or continuing education and want more information about this, or help, support, or Narcan training, please feel free to reach out. My cell phone number is posted and available, and my email, and also our phone number at Unity Point Health, Unity Place, which is accessible and manned to direct you into the appropriate department. Catherine, can you think of anything else that maybe I could add, or do you have anything, any suggestions?
You mentioned your contact information. Would that be the contact that was in your email signature?
Yes.
I can just drop that into the comments
Yes.
in case people are watching and want to have that on hand. So I'll do that in a moment. You mentioned the criminalization of substance use disorder, and I wondered, with the growing awareness of the opioid epidemic, have you noticed a change, maybe a reduction in the degree of criminalization or of that perspective?
So to my knowledge, and this has been, of course, on throughout our media and so on, that some of the state prison locations throughout Illinois have released some of our nonviolent offenders early due to trying to reduce the spread of COVID, of course. But as far as decriminalization, I haven't seen anything that has changed, whether increase or decrease at this point. Sadly, I know there are still people being arrested for drug use, possession, and so on. Now, whether every single one of those individuals are being sent directly to jail, we don't know that. I don't have that information. But I have not personally come across any information of any significant change.
Okay, thank you. And you also mentioned stigma. Could you share maybe just 2 or 3 things that people can do to help reduce that stigma? Maybe
Sure.
in conversations with others or just in the way they interact?
Yes, so having open conversations about substance use disorder, opioid use disorder, that will reduce some of the stigma because it takes away that shame. Opioid use disorder is an illness, just as any other health issue illness, okay? It's not always looked upon like that, like I had mentioned earlier, that this is a moral failing of some sort, when in fact it is a dependence and it is an illness, a health issue. So the language that we use promotes stigma. I hear it every day. So for instance, and this is part of the education that I provide, instead of saying, well, Jane Doe went to treatment and is now clean. Well, instead of using the term clean, instead say Jane Doe went to treatment, is out of treatment, and is now in recovery. So the negative verbiage used is very stigmatizing. I've heard in numerous conversations you know, well, your son is a drug addict. When in fact, my son's a human being and struggles with substance use disorder. So there are methods, there's different methods of stigma. Language, of course, is very important. Another one is perhaps about the stereotype associated with stigma as well, that this only happens to substance use disorder and opioid use disorder only happen to a homeless, poor person. There are no financial or demographic or educational barriers when it comes to substance use disorder or opioid use disorder. This affects anyone and everyone that you could imagine. So with that, the conversations that I have, I'm hopeful that that assists in conveying to others so that they can take that away with them, of reducing some of the stigma.
Thank you. What can people do if they're struggling themselves? I know you mentioned a couple things, a website I think you mentioned, but maybe speak again briefly about what people can do if they're currently struggling, and then maybe also what people can do if they know someone or they think they know someone who may be struggling.
So, of course, if you go to the Unity Point Health Unity Place, if you just Google Unity Place, our website will come up, and there are a lot of different options for adolescents, for adults, mental health, behavioral health, inpatient, outpatient, medication-assisted therapies that are readily available for an individual. The person has to be ready and willing to get that type of care and help. More than not, a family member or a loved one may be very stressed with this situation and try to be forceful with that individual. You cannot force better health and treatment upon someone that's not willing to take that and make use of it. So, but if you go to Unity Place, their website, there's a toll-free number, and I can give that toll-free number to you as well, that you can call, and they will direct you into the right direction, into the right department, to get you specific information to get help.
Thank you. And what's the best way for someone to interact with maybe a friend or a loved one who they think might be struggling? Maybe they don't really know what's going on, but they're concerned for someone.
So, you know, I've been in that situation before. And unfortunately, during the time that my son was struggling with opioid use disorder, support and care and efforts weren't really readily available at that time. So if you have someone that you care about that is struggling with even substance use disorder or opioid use disorder in any way, shape, or form, you are also carrying a heavy burden with you as well. I cannot encourage and stress this enough that you need to also have support as well, so that you are a better help to that individual that's struggling. And at Unity Place, they have a group of counselors that actually focus in on this type of a situation that can guide you and help you along, because your health is just as important. And mental health, more than not, needs to take a priority, no different than our physical health at this time.
Thank you. I don't see any other questions coming in right now, but Is there anything else that comes to mind that you'd like to share with people who may view this recording or who are watching live on Facebook?
Yes, so I'd like to end this with please don't feel alone when it comes to substance use disorder or opioid use disorder, because you're not alone. There are millions of people in the United States that struggle with substance use disorder. Do not feel alone. Reach out to someone, because you'd be amazed of the help and support that is out there and available to you. Every life is worth saving, and that's bottom line. What my position is about is keeping people alive and healthy. You may want to say that it's a part of harm reduction. I'm trying to reduce the harms of opioid use disorder, substance use disorder. So with that, please feel free to reach out to me or go to the Unity Place website and check out the resources that are available to everyone there. I'm always willing to help, whether you text, call, email, in any way that I can.
Thanks so very much. And we will make this recording available on our website or on our Facebook page and YouTube page. Yeah, thank you very much for taking the time to speak with us tonight.
Thank you, Catherine, so much for the opportunity. And if this reaches just one person, hopefully it will be helpful in bettering someone's life or maybe saving their life.
All right. Well, thank you very much. And with that, we will go ahead and close this program.
All right.
Have a good